All right, we have returned. We are from Brazilian Hospital Ibiapaba CEBAMS. Before we start, Edson will start with a little brief about the health situation in Brazil regarding breast cancer and prostate cancer. Edson, please.
Good afternoon to you all. It's a pleasure and an honor to be here today. Well, before our presentation that will be conducted by the main researcher, Professor Ricardo Rios.
Eu acho que eles não estão ouvindo.
Can you hear me?
Justina, can you hear us?
Now it's working. Yes, now it's
Working.
All right.
Okay. We'd like to make some considerations regarding two aspects we consider important. Indeed, the reason of our research. It's important to know that for health communication strategies in countries like Brazil, popular educative campaigns are very important for several reasons and peculiarities. First, we are the largest nation in Latin America. Brazil's physical environment and climate vary greatly from tropical north with rainforests to temperate south. Two, we have 4.5 thousand miles long coast. And three, we have big cities like São Paulo and Rio de Janeiro with the populations over 10 millions of inhabitants and small villages with hundreds of people only. But the education levels are the most dramatic aspect of unequal reality. Like so many aspects of Brazilian life, education opportunities are tied to social class. That's why educative campaigns about serious diseases like prostate cancer and breast cancer are so important. To get people to join preventive exam services, even free, it's essential to do campaigns using easy language, even emotional arguments and images. Nobody likes to think about disease, about cancer, about virus, about pandemic. Everybody wants to be healthy and feel good, but health takes attitude. COVID-19 brings for us a new challenge to this context, and this is why we decided to do this research, because we feel that Blue November and the Pink October, the two great campaigns in Brazil, lost space in media with COVID-19 news and the attention of the people. That's why we're here today.
So, as Edson pointed very well, we have a problem in communication about these two campaigns about breast cancer and prostate cancer. You have free access paid by the state, but people doesn't get these free exams. So, about us here in Brazil, we are the biggest medical center in Barbacena, being the public reference for almost 100 million people in the Brazilian state of Minas Gerais. And we receive patients from private and public healthcare systems. And we have more than 50 years of activities. So, our research problem consisted in a better comprehension about marketing strategies and standards of health communication. To analyze the two campaigns activated early in Brazil, the Pink October and Blue November, and their fight to relevance against COVID-19. So what we did in this, we got some data from Google Trends, and we look at the one thing. If these campaigns generate demands for information about the two types of cancer or not. So we then attempt to understand the effects of Pink October and Blue November as a news consumption index. So if people search more about the addressed topics to the campaigns, it means that a higher amount of news and data about the campaigns and the disease are being consumed by the people. So our methodology, we use identity and the image projection by Castells and Hall, Google Trends as a scientific method by Shenfo et al. And Chamberlain, and Medium and Message by Marshall McLuhan. About our research, what we looked for. We've analyzed two different data. First, we've analyzed data from Google Trends about Pink October, dedicated to breast cancer, and Blue November, dedicated to the prostate cancer. This analysis embraced 3 years of data, 2017, 2018, and 2019, when people searches on Google Brazil about câncer de mama, that means breast cancer, in October, and câncer de próstata, which means prostate cancer in November. Later, after we collected this data, we analyzed the results of these two keywords, câncer de mama and câncer de próstata, from March to June of 2020 for these two terms and compared the data and the public awareness to topics when compared to coronavirus, in Portuguese, coronavírus. So, sorry, Justina?
4 minutes left.
All right.
Extend it to 5 minutes.
All right. So Pink October is a campaign to talk to women, to get some attention to breast cancer. We have some public monuments, public attention,
Parades.
just to talk about this disease. And the same thing occurs in November with the prostate cancer, with the Blue November. These pictures are some actions that we do here in Barbacena to talk about breast cancer and prostate cancer. So let's talk about our results. When you talk about awareness of breast cancer in Pink October, we see that the apex of searches on Brazilian Google about breast cancer have the apex in October. The same thing occurs in 2018 and 2019. We see that the Pink October is an effective campaign to talk the public the risks of this disease. About awareness, about the prostate cancer awareness at Blue November in 2017, in 2018, and 2019, you have the apex of carries on Brazilian Google about prostate cancer was every November. In November, you have the apex of carries about prostate cancer in Brazil. And what about COVID-19? So during March to June, the carries about breast cancer got a scale less one during all the weeks we've analyzed in March to June 2020. Brazil searched a lot more about coronavirus, and that showed loss of awareness for cancer information. If you got cancer, the mama, the breast cancer. And if you look to prostate cancer, to cancer de próstata, you have the same scenario. What is? A loss of awareness and search for information. This is very serious for our health public system. So, let's go into our final remarks. During 2017 and 2019, Brazilian users of Google have searched more about the addressed topics to the campaigns. This means that during the measured time, a high amount of news and data about the campaigns and these diseases were consumed. This is very important to early diagnosis of breast and prostate cancers here in Brazil. Both Pink October and Blue November are essentials to spread messages about cancers and its prevention. The searches for information about this disease endorses the functionality of these campaigns. The reinforcement made by health campaigns named with Color Plus Month is very effective with public, which always search for information about cancers on Google. These actions are very important, as I said before, for the health system. But it is important that medical societies evaluate the plenty of these campaigns for don't confuse the public. Covid-19 pandemic affected a lot the 2020 campaigns, taking visibility from the messages and actions to prevent cancers. The public, in a wrong way, could perceive a thing that these diseases have disappeared, but thousands of people can discover cancers during the pandemic. Only a good media coverage on these topics of Pink October and Blue November will help to keep these campaigns relevant to the public during the COVID-19 pandemic. So thank you for our audience to keep your attention a little bit with us. Here are our contacts on Facebook, Twitter, Instagram, or website. And if you want to look to this data after, you can send us an email through comunicacao@ibiapaba.com.br. Thank you again, and good afternoon.
Thank you.
Thank you very much.